Hello and a very good evening to all our viewers who are joining me in this live interaction session of News 9 on Facebook and YouTube as well. So my first question to all our viewers is, are you guys living in a high-rise building? Well, if you guys are, then you'll have to beware because COVID-19 cases are on the rise in high-rise buildings, and this is my topic for today in today's live interaction because a case study from Mumbai has clearly showed that the number of cases in high-rise buildings have been on the rise compared to slums. So, as Mumbai experiences rise in COVID-19 cases, the number of containment zones in the housing societies has increased from 2,334 to 8,637. So, Mumbai has been experiencing a growth in cases of COVID-19 in the last 12 days, especially in the buildings and housing societies. So, from September 1st to September 12th, the number of containment zones increased from 2,334 to 8,637. But the case in the slums is completely opposite of it. So the number of containment zones in the slums has reduced from 557 to 20. And the current challenge for the BMC is to contain the spread of the disease in the high-rise buildings, because there is where the real problem is lying. So the number of patients in Mumbai has also doubled from 84 to 58 days over the last 10 days as per the details available on the portal of BMC. So in fact, in the month of August, the 31st of August till the 31st of August, it was just 84 days, but now it has been doubled to almost 58 days where the cases will double in Mumbai. So now in order to answer a few questions surrounding this particular topic of today, we have with us Dr. Sitesh Roy. Many thanks for joining me in this live interaction, Dr. Sitesh. And my first question to you is, what is the reason behind the steep rise in cases, especially in high-rise buildings, Doctor?
So, Deepak, I think there are several reasons why this is happening. And being a resident of Mumbai myself, I certainly have some theories which will pan out and hold out if someone were to look at them closely. The first one being, people in buildings and high rises have been fairly secluded till the entire lockdown and the gradual reopening of lockdown was happening, and many of the high rises and societies had restricted the entry of house help into their homes. And they had also restricted their movements in that time frame. And as the unlock has happened, and as people who live in slums or in what might be considered the low socioeconomic housing areas of Mumbai have moved and have come back as house help to the various homes in the high rises and the buildings. And also the people in the high rises have moved, become more mobile and started to go to work or started to do different activities, including shopping, which, as you know, is a very big pastime in Mumbai. We are seeing more and more cases, and certainly this rise may also have to do with the environment, the weather, with the rains and then the dry spells and the changes that occur due to that in the environment, the temperature and the barometric pressures. When you combine the environmental factors, the factors that people are far more mobile, the other big factor, in my opinion, is having fatigue from all the restrictions. So people have been wearing their masks, doing their social distancing, and also using their hand washing and hand sanitizer. And as the system begins to unlock, people have this false perception that the virus is gone or it's no longer an issue. And with all the confusing messages that people are getting in their minds, I believe that they are giving up their precautions and their protection. And because of that, the cases are increasing among those groups that were previously what I would call secluded or protected in their existence so far.
Also, Doctor, now the lifts or elevators could be a COVID-19 nightmare. So many companies and housing societies have overhauled offices to make them COVID-proof, but they aren't able to figure out how to stop the pile-up in the lift. So in the age of COVID-19, waiting for lifts isn't just a mild inconvenience, it has also become a logistical and a major health hazard as well. So what do you have to say about this?
Certainly, as people have been moving
more, getting more functional and back to their daily routine slowly but steadily, and very much noticeable in the Mumbai traffic increasing. Lifts do become a source of transmission because people are in a closed environment and they are together for anywhere between a few seconds to a few minutes. And certainly waiting for lifts as you await it to come, or during your journey in the lift, you can certainly be exposed to this virus in a closed space. And as we know, closed spaces are the smartest way to transmit the SARS-CoV-2 virus, even from an asymptomatic person, which can happen in 40 to 50% cases of transmission. So yes, where possible, people can use the staircases, and it may be safer and better to do that because in a relatively open environment when you're going up and down a staircase. But in really high-rise buildings, the lifts become an issue. And many a times people who live in housing societies and believe that they know each other might again not wear their masks or maintain their physical distancing like they should in the elevators. And that is an equally important thing to do for people living in such high rises.
Now, doctor, when you compare slums and high-rise buildings, high-rise buildings are mostly air-conditioned, whereas slums are in open areas. So, do you think that this could be one of the reasons why the number of cases are increasing in these housing societies?
It's a very interesting concept, Deepak, but I think each area has its own risk. So, with the slums having open air, but at the same time having immense overcrowding inside and around, is why the slum area of a place like Dharavi saw the zero surveillance rates go up to 57% when it was published in July, August, suggesting that the virus went through that area very rapidly, spreading amongst very closely congested, quartered people, and eventually whoever had to get sick got sick. Those who had to become immune got immune or developed antibodies and cellular immunity. And so I think that the slum went through its peak earlier than the high rises are now going through their peak, because they have now become more vulnerable and open as people are becoming more mobile, and people from slums and other areas come into the homes to work and provide services that may have been restricted by a lot of high rises and societies before. That doesn't mean that we should stop having them come, but I believe that the precautions, the wearing of masks, the washing of hands, sanitizing, the maintaining of physical distancing, even with known people, if they are coming from outside and unknown places, is still very important. The high rises with the air conditioning, certainly if someone is in a closed space and someone amongst the people that they are with has the SARS-CoV-2 virus, it can be a problem of transmission in a closed space more than it would be in an open space. But again, Mumbai being the city that it is, with the crore of people, crore and a half of people that live here or more, I think it's difficult sometimes to do that, and hence our personal precautions are the most important, even for the people who live there and the people who go in and out of there.
So, how do you think people can stay safe, especially those who are, living in high-rise buildings, doctor?
As I said, don't let your guard down. I see it in a lot of places. I hear it from my patients every day in my practice. I see it amongst Uber drivers. So just to give you an example, I sometimes will take the Uber, and my Uber driver would always have his mask on his nose whenever I would travel before. And nowadays I have a lot of Uber drivers who have their mask on their mouth or on their chin, and they have to be told. And when I tell them, they say, oh, well, everything is changing and now we are unlocking and people are mobile. So I tell them, but the virus hasn't gone anywhere. So I think the answer is the same. Take your precautions. There are only 3 precautions. Wear your mask, wear it above your nose, and keep it above your nose if you're around people. Make sure that your mask is clean and well maintained. If it has to be changed, change it. Also, hand wash and hand sanitize if you're touching any surfaces, touching any objects or anything like that that may be contaminated by contact with other people, known or unknown. And the last being physical distancing where possible. And I think that that is really the only answer at this point. And if someone has symptoms, it's very important for them to self-isolate themselves, get themselves tested, get themselves treated at the earliest time point, because many people know that they have suspected symptoms of the virus but still choose to go about life like it's normal because they feel they are healthy and nothing will happen to them. And two outcomes can happen in that: either they can suddenly get worse as the disease progresses, or God forbid if that doesn't happen and they are well, they do get well by God's blessings, then maybe they may still spread it to others while they are going about their life routinely. So I think the self-quarantining and self-isolation is another very critical part for us to stop this spread.
Right, Dr. Sitesh, thank you for joining me in this live interaction. Well, that was Dr. Sitesh giving us his opinions and also his valuable insights about why the number of cases in high-rise buildings is increasing with each passing day. Well, guys, now the situation is evolving with circumstances and time. So probably builders could, explore various other architecture to meet the expectations of the people in future, keeping such a situation in mind. So probably the lifts could be more ventilated and the number of units in a high-rise building could be reduced to follow social distancing and to avoid overcrowding. And most of the spaces in the apartment building or in the high-rise buildings could probably look at providing more ventilation than air conditioning. So all of these factors could probably be considered by the builders, but it all remains to be seen how long this pandemic lasts and what impact it will have in our country. So until then, all you have to do is follow all the safety precautions like mentioned by Dr. Sitesh, and probably that will help you get through this pandemic. So if you guys have liked this content which I have presented, please drop in your comments and also like, share and subscribe to News 9 on various social media platforms. Thank you for watching.